The decision to go ahead and purchase the TomoTherapy unit at Monmouth Medical Center actually took us quite a while in investigation. We have always been a leader in IMRT treatments in the state of New Jersey. We were the first community-based hospital to offer IMRT for our patients, and that started in the mid to late 90s. And when we wanted to expand our department and add a third machine, we were really looking to expand our IGRT capabilities. And we were looking at many potential options, including linear accelerators with onboard imagers. However, when we looked at the TomoTherapy unit, we were very excited with the options that this enabled us to offer our patients. The ability to use the CT imaging before every treatment and to offer hypofractionated treatments and really create and expand a body stereotactic program were some of the things that we really thought TomoTherapy can offer us, more so than any other unit that was available on the market. So after looking at all of these issues, we decided to go ahead and purchase the TomoTherapy system. When we were installing the TomoTherapy unit, we did need to build a new bunker. So once the construction of the bunker was complete and we were ready for the installation of TomoTherapy, really the entire process was seamless. The unit was installed. We then had significant amount of support from TomoTherapy in terms of making sure the machine was up and running, and all the necessary work that needed to be done on the machine was done quite quickly. We then had the appropriate training to be done both on-site as well as some training done in Madison at TomoTherapy, and we were able to become clinical virtually immediately. And from day one of becoming clinical with the unit, it was just a very easy process, and the TomoTherapy company was very helpful in making sure that that went smoothly. In fact, I really can't recall any glitches at all in the entire process. The adoption of treating patients with TomoTherapy really went quite easily as well. Our physics staff and dosimetry staff did attend a training course in Wisconsin to help learn the planning system. From the physician point of view, I think the actual process is similar to other technologies in the sense of we contour our target volumes and we decide what targets need to be treated and what structures need to be avoided. And the planning process done by the dosimetry and physics staff really has gone quite smoothly, and they have found the software very easy to incorporate into the planning process. And from the therapy point of view, placing patients and positioning them on the table has gone smoothly, and the image registration process has also been very easy to adapt. For some of our hypofractionated cases and more difficult cases, the physician reviews the images on a daily basis before treatment. For some of our other cases, the therapists are the ones who review the registration. The physicians review it at the end of the day to ensure that they are accurate. But the overall transition from a standard linear accelerator-based treatment to a TomoTherapy treatment case really was a very easy transition to make. I think one of the large advantages of treating a patient on TomoTherapy is really the ability to make our margins of treatment smaller, which means that we're treating less normal tissue while still treating the target to its full dose. And what this translates into clinically is the ability to decrease toxicity to patients during treatment. This is probably most evident in some of our head and neck cancer patients. This is traditionally extremely toxic treatment for the patient with significant side effects. And although the treatment is still difficult for the patients, we have seen a significant reduction in the side effects that the patients have during treatment. I've had many patients who are able to tolerate better intake of food and nutrition throughout their course of treatment while they're treated on TomoTherapy compared to a linear accelerator. And it's also been my experience that in prostate cancer patients treated on TomoTherapy, they have less urinary and bowel symptoms compared to those that were treated on linear accelerators. So it's actually very exciting to see that the patients are tolerating treatment better and getting through the treatment more easily, and it allows us to make sure that the treatments are going smoothly and that they have an easier time getting through the course of treatment. And we also anticipate that we'll continue to have excellent outcomes in terms of treatment results. We do need to continue to follow our patients with time, but we're certainly encouraged with our early results.
Sure.
I think that since our initiation of our TomoTherapy program, we've really seen a large shift in some of the types of patients that we treat. One of the first things we noticed was that we have many patients who are seeking out TomoTherapy. So patients who aren't from our traditional catchment area and have been seen by other doctors and live slightly further from our center are actually calling our center to make appointments because they've heard about TomoTherapy. So it's nice to be able to offer this option to those patients. One of the biggest changes we've seen in our treatment protocols have been really the initiation of a body stereotactic program and expansion of our intracranial stereotactic program. We did have a stereotactic program that we used on our linear accelerator-based treatments, and we would treat anywhere from 5 to 10 patients per year using linear accelerator-based stereotactic treatments. We're currently treating approximately 5 patients per month in some form of stereotactic program using TomoTherapy. The majority of these have been intracranial treatments. However, we've really started to expand our body stereotactic program, and we're able to offer patients retreatment. So patients who've received radiation in the past to various parts of their body. And just as recently as a few years ago, some of these patients may not have had any options for additional radiation. And we are quite comfortable offering these patients a course of stereotactic radiation to these areas, and it really can improve their quality of life and decrease some significant pain that they may be having. And it's nice to be able to tell a patient that they now have treatment options where just a couple of years ago we would be sending them home saying that we could not help them at all. So that's been a real pleasure to be able to have those discussions with patients and give them those opportunities for additional treatment. Occasionally I will see a patient in consultation to discuss potential treatment, and given the location of the tumor on the radiographic scans or the x-rays and CAT scans, etc., sometimes I wonder in the back of my mind if I will be able to adequately treat this patient even with the advanced technology that we have today. And thankfully it's been my surprise sometimes to see that when we actually do the planning process on TomoTherapy, that the system is able to create truly incredible treatment plans where we're able to get the high doses we need to treat the tumor and minimize the dose to those surrounding normal tissues. And even today, when I continue to use the system more and more frequently, I am often surprised at what a great job the system can do, and it amazes me, even with all my medical training and in radiation oncology, to see that the system can actually create some of these plans which are really unique to TomoTherapy, and I have not seen this accomplished on other treatment planning systems.